All right. Well, thank you everyone for coming to this campfire chat. This is the lessons learned of COVID-19 and the path forward. So just a few logistics before we get started. We encourage all of you to turn your cameras on. You have the ability in this session to have your microphones and cameras on. We do ask that you stay on mute unless you are speaking, just so we don't get a lot of echo. And if you would like to ask a question, please raise your hand. It's down in the participants list there. You'll see in the controls, you can see here, there's either a raise hand or under reactions, depending upon what version of Zoom you're running. And you may also put your questions in chat, and Arlene Kahn, policy analyst at PHADA here, will read those questions to our panelists, who will then answer them as best we can. So without further ado, I'd like to just quickly reintroduce our panelists from our earlier session. Brenda Westfall's the executive director of the Ithaca Housing Authority. Jean Reed, executive director of Abilene Housing Authority in Texas, and Brian Gage, the executive director of the Akron Metropolitan Housing Authority in Akron, Ohio. So again, we'd like to thank all of you for attending now. And we'll start off. We were going to continue our questions from our previous session, but we really answered them all in that session. The one outstanding question was about sharing some of the policy documents, which we will be posting into the Whova app shortly, and we'll also share them on our website after the conference is over as well. So I'd like to turn it over to Arlene, and also again invite our participants here to, if you have a question, please raise your hand or put a question in the chat. Otherwise, if we want to just kind of continue where we left off from the previous session, let's get started.
Well, and I would just add, it doesn't have to be a question. If you just want to make a comment or share something that you want to share just on its own, or something that relates to what was said at the session. I mean, it doesn't have to be a question. It can just be something you want to share, and then the panelists can comment on that. And I don't see anything yet in the chat, so I'm just going to go to a few of the questions we had, if we had additional time during the first session. People can just jump in. I won't call you out, Brian, Jean, and Brenda. If you have something to say, you can add to it, but don't feel compelled to all speak on every question. But the first question is, what were you most unprepared to address during the pandemic? Or maybe you were completely prepared.
I guess I'm off of mute, so I'll go first real quick. Okay. And I just wanted to mention that Cindy's got her hand up over there, so we can jump to her after this question too. So, but I think the thing we're most prepared for at the beginning was the having the PPE and being prepared, right, to deal with it. And I think going forward, we're aware of that. We're prepared for it. And we're ready for the next pandemic as that comes out. But, we were scrambling for masks. We were scrambling for hand sanitizer. We had plenty of cleansers, but keeping our folks safe with the right equipment was the initial challenge right off of the bat. So that's something that we learned from very quickly.
To Jean and Brenda, want to add to that? Or?
Yeah, I mean, I don't want to make it sound like we were perfect, but like I say, we got started a lot earlier than most agencies. So we had a very intense planning session, and we went step by step, right? Entirely through our operations, entirely from, walking in the door into how we got through the building and whatnot. So we spent a considerable amount of time working through the entire situation and coming up with a plan that would keep our major functions running, right? And our initial goal was, how do we complete things without interacting directly together? And that's kind of the premise that we started with. So like I say, I thought my team did a really good job. You know, we thought about how we connect to other agencies and things like that. But if there was one thing, well, I would say the thing with this particular item was it was a constant moving target, right? So I couldn't set my bow and then just shoot at a stationary target. This thing was changing daily, hourly sometimes. And the challenge, and I'm a news nut, right? I watch the news from the time I wake up to I go to sleep, right? So I was hearing a lot of information before it hit Abilene, right? And we started taking those progressive steps to address things, even though they weren't quite happening in rural Texas as of yet, but we knew they were coming. So for folks like Brenda was right there in New York, right, where everything was happening. You know, it was happening a lot faster than it was happening out in our area. But we made sure that we stayed atop abreast of what was going on nationally. And within the housing authority, we started addressing things like they were there. So we were really out in front of things. Now, to Brian's point of PPE, each year, right, that I've been here for 13 years. When we start to get to that September timeframe, we always buy a lot of PPE, right? The hand sanitizer, gloves, the wipes and things like that. So because we were there, you know, as everybody was scrambling to get those things, we had a pretty considerable stash already because it's a part of our normal operating procedure to get those just because the common cold and flu are occurring at those times of year. So,
great.
Yeah.
Yeah, you're a step ahead. And I'm very sorry, Cindy, I didn't see your hand up. Go right ahead. And you're muted though. Cindy name.
Well, do you want Brenda to have an opportunity to answer?
Well, I don't, is she there? Because I'm not seeing her on my screen.
She's on.
Brenda's
I'm here.
I'm here.
You are. Go ahead.
Yes.
Thank you, Cindy.
I'll just add in that, you know, I would say that it was the unexpected because we didn't know, like Jean said, there are so many moving parts. We were watching what was going on around us. We were listening to what was happening in the community by staying in connection with the health department. But then you had your radar up with everybody else around you. And like I said, my good friend is down in New Rochelle and she's operating out of what looks like a war zone with the National Guard. And I'm trying to figure out plan D, E, and F if we become New Rochelle. So the unexpected, because there was no way to determine the changes that were forthcoming. There were times when the governor would put out a directive and I'd get a memo out to 341 tenants. Only by the end of that day, I'm putting out another memo, retracting the first memo, or in here at 10 o'clock on a Sunday night, delivering a memo because on Monday, the memo that I put out Friday said that on Monday at 9 a.m. we're going to have a meeting, but now the local directives have been, you can't have that meeting that you could have had on that you could have on Friday. So much stuff was changing. In terms of the PPE, unlike Jean, we weren't an agency that would have hand sanitizer. Yes, plenty of soap, Lysol wipes, some, but certainly not the amount that we needed. And we were lucky enough in this area to be able to collect those things either through our suppliers, which was difficult. We waited months just to get hand sanitizer stations for our senior buildings. But we were able to get a supply because we had a number of resources in the community that would give us tips when the local stores would stock. And if that tip was at midnight, because the stores that would be open 24 hours a day shut down, they stopped being open 24 hours a day because they couldn't get the stock on the shelves before people were coming in to get it. We were lucky enough to have a surplus where we were able to ship off and loan to a neighboring housing authority. But there were times when we questioned our own supplies and the fear that we too would run out and wouldn't be able to get them or be able to get the tenants what they needed.
Thank you, Brenda. Cindy, would you like to ask your question now?
Well, I do. I have a couple of observations I would share. Being in the Midwest, we weren't hit the soonest, so we were able to stockpile on supplies. So we were getting that. We approached local churches and they made masks for our tenants. So everybody could come down to the office and pick out 1 or 2 free masks. We already had some on hand because we would use masks and gloves during inspections. Every day I ask the staff, what else should we be doing? Is there something, because I'm sure I can't think of everything. You guys have great ideas too. What else should we be doing? I was worried about toilet paper. I didn't want the tenants using newspaper, and we're a story tall building. So immediately we ordered cases of toilet paper and let the tenants know if you can't find it in stores, we've got it in the office. Come buy a roll for 50 cents or whatever. But I thought the first couple of days, all I did was write policies. I just wrote policies like crazy. I came out with some trainings later, but and I know they're a big machine and they can only move so fast. And they had a lot of things to get in order. But I really felt like our guidance maybe could have been a little faster. But as long as they put in that notice, do what's best, cause no harm, that's the steps we move forward. The other thing I was fortunate enough with, and maybe this would be a tip for everybody, is when you set up your housing authority board, get those instrumental people on your board. The public health director is on the housing authority board. I had a direct ear to her and could ask her all kinds of questions. What should I be doing? I know you're really busy, but I could send her a text and she could get back to me when she was available. But I'm wondering what everybody did when you had tenants get COVID. We had put up a note and asked that only essential people come in the building. We stayed at work. Only essential people, and tenants don't understand what that is. So we gave them an example. Maintenance, repairs, pest control, caregivers, housekeepers, delivery people, things like that were the essential people. Don't be having Aunt Mac and Uncle Martha and everybody in and out checking on you. They can call you. You don't have to have everybody here. But I would be curious how everybody else handled when they had a tenant come down with COVID.
Yeah, well, Cindy, we, especially for our public housing, one of the things that, we put out in our notification is that, hey, if you do contract COVID, please let us know. So our initial goal was safety, not only for that participant, but obviously for individuals around them. So we actually teamed up with the health department, and, our mandate, internally was if we find out that someone has COVID, we want to know what their needs are. So we had our resident services coordinator get in contact with that family and find out, hey, you can't leave the unit. What do you need, right? Is it food that you need and things like that? So we coordinated with our health department and we made sure that we knew exactly what their needs were. So we went to different pantries for them, or we would go to the stores for them and actually provide them food. But within our community, and this is very positive from our community, our health department was also doing the same thing, right? They were ensuring that the needs of those families were met. So if they had grocery store needs, they were making sure they had groceries. If they had medical needs and prescriptions, they were making sure that those prescriptions were delivered. So we put it on the porch. We'd allow them to get it. And then we just asked them to stay in contact with us in terms of how we were doing. So our staff, again, followed up with phone calls on a daily basis just to see, hey, how things are going. Sometimes there was a kid in the family. Sometimes there was another person in the family, but sometimes it was just that individual. So those folks we had real concern for, because if they really took a downturn, we were kind of concerned about it. So if we didn't hear from them, we'd go knock on the door. We'd stand way back with our protective gear on just to make sure that those folks were safe.
Thank you.
In Akron, we had a similar thing. The public health department took care of all of basically the needs. So we didn't need to step in, but where we did step in was there was quite a few people that were afraid to get on public transit or afraid to go to the doctor's office or afraid to go to the grocery store. So that's where we organized PPE drops and food drops and those sort of things with all of our partners to bring it, even regardless of whether they had COVID or not, you know, just to keep people safe and not getting COVID. So we had very little exposure in our actual sites, much lower than the regular population. So
that's great. Brenda, did you want to add anything?
Yes. So in Ithaca, we didn't have our first COVID positive tenant until November of 2020. That was a tenant of our senior building. And again, because of our partnership with Visiting Nurse Services and the program that we have in the senior building, we knew of that tenant immediately. We had concerns for that tenant because he had absolutely no family at all. We were concerned about how he would safely transition from the hospital back home, and then who would accommodate him with food, medication, or whatever it is that he needed. So we used our internal resources, but like Brian said, our health department was also directly in contact with anybody in Tompkins County that contracted COVID. So if they didn't have a way to get food or they didn't have transportation, there are resources out there that would bring food to their doorstep if they needed it. We also, as I said, had the monthly food giveaway. So we made sure that tenants were stocked with those things. We communicated with the health department, and we had a lot of volunteers that ended up at Cornell just making masks for months and months. So the Housing Authority had a stockpile of masks and hand sanitizer from the health department. And we made sure that those things were given out to all of our tenants, our seniors, as well as our families in 3 different properties. To date, to our knowledge, we've only had 2 COVID positive tenants in our senior buildings and 1 COVID positive in our family sites. And all of them communicated to the Housing Authority immediately so that we were sure that we're not sending staff into a COVID positive environment. They were excellent with the communication.
Great, thank you, Brenda. And we have a question from Tim Kaiser and then Brian Hoffman.
I couldn't attend your session because I had a conflict, and I apologize if you already addressed this issue, but I'm curious how you and your staffs adapted to telework and whether any of you plan to continue with some form of hybrid in-person and telework in the future.
Our staff loved it. We're keeping it. Our productivity did not decline as a lot of my executive staff was fearful of. So we actually saw in some areas an increase in productivity. And efficiency. So we're keeping it in some form.
Yeah, Tim, I can't believe you didn't make our first session, but we're glad to, hey, we're glad to have you now. But yeah, so, you know, surprisingly, we had a lot of staff that wanted to come to the office, right? So, you know, we initially closed to the public. Probably about 2 or 3 weeks after we closed to the public, we shut down completely. We went remote, and I had a number of my staff that said, "Hey, we want to come back to the office," right? So we put all the protocols in place to make sure that we were socially distanced, that everybody had their PPE on, and we were wiping down surfaces and things like that. So, so probably after about 2 months of being completely closed and working remote, yeah, we actually had staff start coming back, and we were working in different shifts. So, you know, 2 or 3 people would come in during the first part of the day. In the afternoon, the other folks would come in. But right now, we're still kind of undecided totally on whether we're going to stay remote or, you know, come into the office. So, yeah, that question is still up in the air for us.
Brenda?
So Tim, we only had 3 staff that worked remote, and only for about a 6-week period of time. 2 of them were our FSS caseworkers, and 1 was a Section 8 counselor. Again, like Jean, I only have about 25 staff. People were saying, please don't send me home. I don't want to work remote. It'll be too difficult. We're not paperless. We live in this paper world. And I kept saying to them, we will do that as long as we can safely operate that way. But there could become a day when it's no longer safe for us to be here. So, you know, given Governor Cuomo's orders, we had every plan under the sun to figure out how to keep the operation running and to serve our clients. And we did that well. We closed to the general public, and we're still closed to the general public today. As a result of that, caseworkers became much more efficient. The Section 8 department is a month and a half ahead on their processing, the public housing department. So when agencies were falling behind for whatever reason, we were actually getting ahead. You know, that was a light bulb. We can be more efficient. As I said earlier in the session, when you think you're great, all you need is a pandemic to make you realize you're not that great. And you could do things differently. You could streamline, you know, outsource, become paperless, put other processes in place. So out of those 3 people that did remote work, I have to be honest, 2 of them still came to the office at least 1 day a week for a period of time. It was almost like they couldn't live without touching paper or something. Even though we were trying to make it as simple as as possible. They just loved that process. I would be more open-minded than I was before the pandemic. Before the pandemic, I would be honest and say, I was 100%, there's no way this is going to work. I've been inside this agency for 32 years. You have to be in it to do it. I think differently about that now. And I say that too, as we're on the cusp of growing and we're running out of space. We're running out of administrative offices to put people in. So it's making me think who could work remotely or who could work from another location and still achieve even better results than we had before the pandemic.
And Arlene, I'll say this in respect to that too. So when we look at a split of employees, my management staff wants to work remote. My staff level employees want to come to the office. So right. Yeah, it's an interesting dynamic.
Makes sense though. Brian, did you want to ask your question, Brian Hoffman?
I just have a couple of comments. It's interesting, listen to other people talk about how things happen. In Lebanon County, we're small. We don't have a public health department at all. So that presented challenges. Tenants, I guess it's part of our anti-government feeling here. It was extremely difficult to get tenants to tell us if they were COVID positive. Most of the tenants' attitude was, that's my business. You have no right to know it. Don't ask. We would sometimes find out, maybe an adult child or elder would call and say, hey, you didn't know my mom has COVID. Sometimes they got very angry when we did go to them and say, hey, your daughter told us you have COVID. And they would say, that's none of your damn business. Trying to force people to stay in their apartments when they were COVID positive was really difficult. They were, again, like, you can't tell me what to do. I do what I want to do. And it was a really big challenge dealing with the tenants. People wouldn't wear masks. They just absolutely were, I'm not wearing a mask. You're not going to tell me to wear a mask. Going into buildings and finding people still, even if we close community rooms, still find them congregating in lobbies, no masks. And boy, that was our big challenge. People just would not follow the guidelines. And we had mass food distributions so people didn't have to come out of their apartments. Staff volunteered to do that. I was really, really proud of how much work they put into it. But I would just say the extremely low level of tenant cooperation was extremely frustrating.
Yeah, that sounds
everything we could do to protect people and them seem unwilling to do almost anything themselves.
Very challenging. Thanks for sharing that, Brian. We do have a couple of questions in the chat. If any of the panelists want to address how their authorities handle paperwork for recertifications while also being able to use COVID precautions.
I can mention that as we, any actual paperwork that we had come into the office was isolated for a period of time. We had a Dropbox. So we did not have UV lighting or anything to irradiate it, but it was at least, sequestered for a while.
Great, thank you.
Yeah, so So we just used our mailbox. We weren't able to quickly acquire a drop box. So we just used our mailbox, and we allowed individuals to put that mail into that mailbox. So, you know, the major concern initially when all of this started is how is it transmitted, right? What surfaces is it on, and how long will it last on each one of those surfaces? So, you know, in addressing those concerns with our staff, obviously they were well-founded and had reason for concern. So what we would do is we would gather that mail. Somebody would get the mail with gloves, and we would just set it in a abandoned office for 3 days, right? I think that was some of the first protocol that came out. So we would just let it sit there for about 3 days, and then we would start to utilize it, right? So some of the things that we really didn't want paperwork for, you know, we started working through that process of, hey, let's utilize the technology that we have. Let's take pictures of things that we have that you need to send to us, and just send that to an email address. And we set up a specific email address for public housing and HCV where folks could take pictures of documents and actually email all this information to us. So that was our preferred choice. So we didn't have to handle it physically. But for the ones that didn't have that access, they would just drop it off in our mailbox. We would set it for 3 days, and then we would start to handle it. So from our perspective, did it slow our operations down, especially initially? Yeah, it did, just because we had to work through some of those nuances.
Okay, thanks. I'm just going to try to get this last question in, since we had two of you address that. And we didn't discuss this in the session. This question is, could you all speak about your perspective on eviction moratorium, how they've impacted you, and what your plan for the summer fall is as the policies change? Did any of you have to address the eviction?
Our TAR has gone up. So we have huge amounts of unpaid rent. We have no way to enforce it. So it is a challenge on the public housing side. I'm not saying that it's bad, but yeah, we're going to have to deal with high TAR.
Yeah, from our perspective, we didn't have a lot of individuals that didn't pay in public housing, so it wasn't a tremendous issue there. Is it a challenge? I guess the second piece of that is it a challenge for landlords, right, on our voucher program? It most definitely is, right? So I don't think it's an easy fix, right? We love to see our participants taken care of. But as a business person, I understand the dilemma that landlords are facing right now, that they have mortgages to pay and folks can live in those units without having to pay. So, yeah, so it's a major dilemma. Like I say, I can see both sides of the equation, but I don't think there's a easy answer to either.
Thank you. I mean, good. Brenda, did you want to say something?
Yeah, I was just going to add that in New York State, our eviction moratorium has been extended even longer. I believe it's the end of August now. We were in the queue with the pending eviction when COVID hit. So in March, because we were already in the queue, we were able to get in front of the courts, and we were able to show that the individual that we were evicting, a resident of the senior building living on a fixed income, was not affected by COVID at all, but just chose to not pay his rent for 15 or 16 months. We won that eviction, and we ended up, the tenant ended up leaving before the warrant was able to be served. But right now where we're sitting, the TARs are going up, just like Brian, and the eviction moratorium is extended in New York State. And per the attorney, we're not going to be able to even start another eviction until after that lapse.
Thank you.
Arlene, can I jump into the next one, which is hazard pay?
Yes, I was just going to say it, and if anyone has to leave, feel free to leave.
Yeah.
Blake said we can go a little longer. Yeah, go ahead.
All of our union employees, because they're all treated equal in the union agreement, received a $500 bonus twice, one at the beginning of the pandemic, one at the end of the year. And then our non-bargaining unit staff, we actually were having folks track hours that they spent on COVID-related activities, and we used that as a guidance for their bonuses. It was up to $5,000 for a non-bargaining unit.
Do either Jean or Brenda want to comment on that as well, how you determine the amount of hazard pay?
Sure. So I'll just jump in and say that ours was based on the amount of exposure that the staff experienced. No, we did not feel that any staff member experienced more than our frontline maintenance workers. They were in it every single day. They were cleaning the building. They were out moving around with the population of tenants. They were having to go in apartments if necessary. The rest of us, we have some office space. We, kind of protected from it. The highest hazard pay that we awarded was $2,500. It was a one-time payment. And then it trickled down to $500, depending on whether you're full-time, part-time, whether you worked remotely, whether you came to the office, even one day a week, or you didn't come to the office. And again, over a period of time.
Thank you, Brenda.
Yeah.
Go ahead.
And
Jim.
Arlene, we actually didn't do any hazard pay. So all of our processes we had in place made sure that folks did not have to come in contact with anyone to get things done. So we didn't have to offer hazard pay.
You wonder if there are as many answers to these questions as there are housing authorities across the country, because everyone does it a slightly different way depending on what's happening in your locality, which is why FADA always says everything's local, and I think during the pandemic, we really saw that. And so I just want to thank the panelists and everyone who attended. It was a great session this afternoon, and this helped a lot to enhance that. And I want to thank you all for how hard you're all working for what everyone considers really one of the hardest years they faced, even people who've been in the business for decades. So kudos to you all, and I hope you continue to manage things well and we get beyond this very quickly. And with that, I'll turn it back to Blake.
Hey, thank you very much. We'd like to thank all of you for attending. And just a quick reminder that a recording of this Campfire chat will be available on the Whova web and mobile app shortly in a short while. We're going to take about an hour break before the next session. So during which time, again, we invite you to please stretch your legs, grab some coffee, network with your fellow attendees on the Whova app, and please visit the virtual exhibit hall as well. There will be a survey available for you to take, which we encourage you to do so. And again, a reminder that the next session will begin promptly at 4 p.m. Eastern Time. Thank you all again for attending.